Here at Calvary, we have a perfect program, a perfect fit for every patient and family member. We talk about the patients that should come inpatient. Usually they have acute needs that cannot be met at home, so they need to be on an inpatient level of care. Or we may have somebody where the family says, I would love to take my family member home. We have a wonderful home service. We have a regular certified home health agency, as well as a hospice at home.
Often in the medical community, there's a bit of misunderstanding about what Calvary Hospital and Calvary Hospice offers. The kinds of patients that are treated here are patients who are entering into their latest stages of life and now are in need of very specific specialty care related to symptom management, most particularly pain management. Often patients are admitted to acute care institutions, and it's understood at that time that cure is no longer possible and that for continued care of the patient, a referral to Calvary Hospital makes great sense. We are also not constrained by a short period of time for the admission of the patient, as is typical in inpatient hospice, so that the care of the patients at Calvary Hospital continues over a prolonged period of time with aggressive interventions that are necessary for adequate control of symptoms.
Most of our patients at Calvary are referred to other hospitals, the acute care hospitals in our surrounding area. Patients that have come in, they may have been debilitated upon admission, but when they come in here, they get a lot of TLC and, they start eating a little bit better or drinking better. Maybe they're able to take their medications by mouth rather than through IV. And if we can, patients love to go home. So we make a seamless transition from the hospital to our home programs.
What a wonderful gift it is that the families are able to do for their loved ones, help them to stay at home as long as possible, and quite often through the very end of life. The challenge for us is to meet the very unique needs of each individual patient and family. At this point now, we care for patients in 7 counties throughout New York, Westchester, Rockland County, Nassau County. We have over the years expanded our services for individuals who are residents of nursing homes, and that is their home. We now take care of patients in assisted livings for the elderly, group homes for the mentally disabled, and we're now beginning to work much more extensively with the inpatient level of hospice care, as we now have a program at Mary Manning Walsh in Manhattan, a program at Ozanam Hall in Queens, and we contract now with the New York Presbyterian System to provide inpatient services to patients in Cornell, Columbia, and the Allen as well.
Here at Calvary, patients get to know about Calvary, get to learn about Calvary through our outreach nurses. They cover every borough and they go into hospitals, they do educational services, they encourage patients and families to come and have a tour of Calvary.
We've also had the opportunity to explain services, but also to give a bit of education about the sophistication of this program and the services we provide to the general medical public.
People know of Calvary, and they equate it with the best possible care for those who are at the very end of life. We see it in the number of healthcare professionals in the New York City area who refer their loved ones to us. And I can only hope that that reputation helps to enhance the hospice care throughout the entire region.